6-year-old female child presented with non-blankable petechial rash on the lower limbs and buttocks. Non-blankable petechial rash. So petechia on buttocks. 3+ urinary proteins. So there is renal involvement. Joint pains in knee and ankle. So large joint arthralgia is present. Preceding sore throat 2 weeks back. Adequately treated with oral macrolides. What is the therapy of choice? Look at the options: conservative management, steroids, IVIG, plasmapheresis. First, you need to make the diagnosis. According to Euler criteria, presence of petechial rash without thrombocytopenia on the buttocks and lower limbs, along with features like a renal involvement or arthritis, arthralgia or GI involvement or any tissue biopsy evidence of IgA, the diagnosis in the patient is Henoch-Schönlein purpura. Let us revise the diagnostic criteria for HSP. So the Euler criteria says the mandatory criteria is purpura or petechia with lower limb predominance. Lower limb, when we say, we include the buttocks in that. And minimum 1 out of these 4 criteria should be present. There should be diffuse abdominal pain with acute onset, so GI involvement, or histopathology, that is biopsy showing leukocytoclastic vasculitis or proliferative GN with IgA deposits, or arthritis or arthralgia of acute onset, or renal involvement in the form of proteinuria or hematuria. So in this child, the diagnostic criteria are being fulfilled. So the child is having Henoch-Schönlein purpura. What is the management of HSP? Management is very clear. Nelson clearly says management is supportive or conservative therapy in majority of these patients. You will go in for hydration, you will go in for analgesia, and you will manage any management of any complications which are happening. What is the role of steroids? Now, short course of steroids or prednisolone is indicated in 2 scenarios. In case there is a severe GI involvement, sometimes only GI involvement is mentioned. This child does not have any GI involvement if you look at the case. And secondly, it will be indicated in any life-threatening situations, life-threatening complications. Giving steroid does not reduce the risk of developing nephritis in the patient. So this is the management that we give for Henoch-Schönlein purpura. And so looking at the option again, the diagnosis is HSP, and so conservative management is needed. There is no GI involvement in the question. There is no life-threatening feature present in the patient, and so conservative management will be needed. Many cases, most cases in fact, HSP, they are precipitated by a preceding infection 1 to 3 weeks back.